Welcome to another broadcast from mindyourhealthcast.com. Well, here we are at one of our weekly gatherings again. I'm assuming that over the years that more and more people will choose to join, and a few will probably choose to drop out when they look at what we're talking about and decide, well, it may not be so scientific because after all, Dr. So-and-so said so-and-so. Therefore, I've decided to call this What to Believe. Because it's true. One only has to go on the internet for any given subject, and especially as that relates to health and nutrition, and you will find one site that says you must never take this product. It could cause great harm in your system, and then you go to another site that says you must always take this product, or you could develop some serious health problems. So the question is what to believe, and the answer is it's difficult. It's difficult in a world of an information glut. And to me, that's kind of what it is an information glut. So I decided to kind of illustrate a little bit about what we're talking about and let you have some ideas about critical thinking. Now, I have mentioned before that there is a little book, I have it on my shelf, called How to Lie with Statistics. And I would say that one of the best things you could do for yourself is to buy the book. Now, it's not really trying to teach you how to lie with statistics. There's already plenty of people out there exercising that. But what it does is it gives you a little insight into statistics without going into mathematics of probability and likelihood and et cetera, and just being able to read something and look at the way it's presented and to determine if it's very likely that what they are saying, it says, is what it's really saying. I have read that book probably a couple times, and I read it many years ago, and it is a very good mini course because it's not extremely detailed, and it's not meant to be. It's written for the average person to sit down and look at a graph and have some company or person say, now see, this graph proves, and you see a bunch of horizontal lines, some longer than other, or a bunch of vertical lines, some taller than others, and then they say, now see, this proves that such and such does such and such. So when you read the book, you'll be able to determine a bit, is that really saying what they're saying it's saying? Or is it just impressive because you see a graph with a lot of lines and you think it must be scientific, therefore it must be proving what they're saying it's proving, which is not necessarily true. So we want to give you some examples of a sort, and I, of course, apply it to the field of health and nutrition because that is my forte, has been for around 40 years or so. And let you look into whether or not what you're being told about things is accurate. Now, right offhand, how many times have you heard someone say, well, science has proven? And as soon as you hear the word science, it must be true because scientists are cool, calculating, and accurate and objective in their approach, and therefore, if they have concluded that so-and-so is true, then absolutely it must be true. Now, if you buy that, then you are buying into the religion of scientism, and I mentioned that last time. Scientism is a religion who clothes themselves in the idea that they are scientists, and therefore what they conclude and what they say is the absolute truth. Now, I don't even have time to get into it, but I can look back over the years at what scientists have said But again, I'm saying more often it's scientism, the religion, not science, the science, whereby you are truly objective, you are open-minded, you look at all the facts, and you don't reach any conclusion until you have a lot of facts, and then even after that, you only create a hypothesis. And a hypothesis means there's a possible likelihood that this is accurate or true. And then, over time, with lots of investigation by a lot of different investigators, you may find it totally turned around or greatly altered, or it may be refined so that it was generally true, but not quite. There were some loopholes that weren't filled yet, and down the road other researchers eventually fill those. But what you're going to find out is that hardly anything is 100% absolute when it comes to scientific investigation. There are so many variables. For example, when a drug is put on the market, it goes through a certain investigations and ultimately limited human trials before it's released on the market. And they don't really know a tremendous amount about it because it doesn't have enough investigation of enough variables of enough different people. And there are so many variables that you should look at that is not done for whatever reason. But at any rate, this drug comes out in the market, and it's supposedly to arrest a certain set of symptoms and be reasonably safe for people to take. Now, that's kind of the criteria. And of course, a third criterion is that it must exceed placebo. By how much? Not very much. In other words, if 4 out of 10 people who took the drug felt some effect, and 4 out of 10 of the people who took the placebo felt some effect, then the drug would be equal to placebo, so you would be just as well off to take the cheap placebo and get the same effect as you would by taking the expensive drug. And so, more often than not, the drug only has to exceed placebo by 1 or 2 or 3 percentage points. And the likelihood, because of the limited number of people who were exposed to the study, that's not what I call good hard science. Now, hard science means that you go into any investigation with no predetermined expectation as to the answer. And hence, you are open to any and all information and data related to that. And only after a period of time when you gathered enough data that you sit down, organize it, and say, can we draw any general conclusion from that? But in the meantime, they have ruled out no piece of evidence, because all pieces of evidence are pertinent, even sometimes when they seem to be little or nothing. And we don't even have time to get into it, but if you go back in physics, you would find that they felt that the turn of the century, roughly, that we knew everything there was. And when I say the turn of the century, that was the 1800s to the 1900s. That they felt that they pretty well knew everything about physics. It was only a matter of ironing out a couple of small details. And as many attorneys say, the devil is in the details. Those 2 little details opened a whole new can of worms that totally changed the whole view of physics and brought into play quantum physics, which is, as Werner Heisenberg, one of the originators of the concept of quantum physics, says, if after you have read it, you are not considering it totally outlandish, you didn't even understand what you read. But anyhow, just those two little details, which one of these days, I think we've kind of alluded to them back in time past, had to do with something called the dark body radiation and, well, something like the photoelectric effect and so forth. There was some little details that seemed insignificant at the time because, after all, we have scientifically arrived at an understanding of physics. As it ended up, of course, they were just at the kindergarten level of what physics is really all about. And so we see the same thing in medicine. We hear that term thrown about. Scientific. This is a scientific study. Where's the science for nutrition? Where's the science for herbal medicine? Well, the fact is that the science is there as much as anything else. It's just that you don't want to actually bring it to the foreground because you're selling another product and making a huge amount of money off of it, and you certainly don't want somebody to bring along something that's less expensive and may actually get people well, because if you haven't come to the conclusion yet that the whole existence of our outlandish sick bill in this country is based on the fact that you may feel a little better, but you're not well, and you're going to be back for more, so that you become a lifelong participant in the medical system. So it's important that you are willing to make that trade to buy some comfort today at the expense of your health down the road, and think that everything is fine, because after all, symptoms are the disease, which of course is inaccurate. In most cases, the symptoms are the immune system attempting to correct a problem when it can be uncomfortable. And so if you can give somebody something that turns off all those symptoms, then guess what happens? You can... I had to stop and take this drink of water. I know it's politically incorrect. But at any rate, you look at this and, well, I'm going to illustrate a little more. I've been in the field long enough to watch a lot of change, but of course not in the field long enough to personally have lived through all the change over the last 200 years. It would be nice if I were, but unfortunately that's not the case. But I have studied it, and so we're going to talk about, starting from the beginning of this. I want to get into the more modern side, and then we'll talk a little bit about two resources which are very good information, and a lot of it is made available free. They don't charge an arm and a leg. Now, if you buy a good book on nutrition, you might pay $15, $20, $25, $30. If you buy a good book on medicine, you may pay $125 to $250 for a book. It's quite interesting how, of course, medicine accuses people in the natural health field of doing it for money, and of course none of them make big money compared to the money that comes out to have to pay for modern medicine. They build a piece of equipment that cost a few $1 million to buy, and therefore they have to run a lot of tests at many thousands of dollars to justify owning a machine of that nature. And so many times, as long as they can come up with a reason, they're going to make use of that equipment because they got to pay for it. And so that immediately raises the price way up. Now, am I saying it's never valuable? No, there are cases when it can be very helpful. But like everything else, if money is involved, abuses occur. In fact, it got so bad that the medical establishment, via the insurance companies, put certain restrictions and limitations on because it was being abused. Now, I know of some doctors who were removed from hospital privileges because they were not prescribing enough of the pills, like aspirin at $1 a pill, or they were not prescribing enough x-rays, or they were not prescribing enough CT scans, or they were not prescribing enough of any of the other expensive pieces of equipment that they have available in the hospital. And so they were no longer an asset for the hospital, they were a liability. So they no longer had any privileges to come in and utilize their facility for their patients. Anyhow, it in more cases than not does involve money, and it's always interesting to me when I hear the critics say, well gee, they were making money. I was reading this one critic, which I'll mention in a minute, who was complaining about a company who makes nutritional supplements, that if I would have taken what they said I should take, it would cost me $7 a day. And that's for a lot of different supplements. And I'm laughing because a course of some of the antibiotics are $20 a pill. And some of the chemotherapeutic treatments are several $1,000s per treatment. And I know that the cost is nowhere near that. In many cases, you can make an ampule of a very toxic substance, which you can't put much in it because it would kill you, and they can make it for 50 cents or $1, and they sell it to you for $3,000. Now, I think that that's way beyond the pot calling the kettle black. I don't think there's any medical procedure that they're handing out to you at a discounted price or free. Even a lot of the experimental things people are still paying for. And so it's a joke to me, and I'm saying that because when you read the critique about certain people, they always throw in, well, they're making some money. Well, if you're providing a service, since when was it illegal or immoral to make a living out providing a good service to people? I mean, that doesn't make sense to me. Okay, what to believe? I recently just printed out from the internet a course, actually, by a doctor that was born in Germany. I guess it was actually Stuttgart he was born, and who has made a move toward natural medicine. Now, that's not unusual, at least it hasn't been in Germany, because I studied there over several study trips, actually 7. And many doctors over there were using a lot of natural methods. There were a few that were hardline pharmaceutical doctors, but there's a lot, in fact, a very high percentage. At one point when I was going over there, at least 60% of the medical doctors were using some form of natural therapies along with what they were doing, and there were many that used only natural therapies. They didn't use anything else. But at any rate, this doctor chose to go a different direction. Now, he gives out free this course because he set up a foundation, and he funds the foundation himself to do research. He funds the foundation, which in turn, he set up a research organization to do actual research on natural medicine. But he is actually funding it himself. There's no government subsidies, no handout to him, and he's done it on his own. And he's treated a lot of people on his own, and not become independently wealthy as they might lead you to believe. Well, anyhow, his name is Matthias, we would say Rath, R-A-T-H. In German it would be Rath. And he has become known around the world because one of the things that he was doing and has been doing over the years was opposing the Codex Alimentarius, which was the drug companies were trying to make it illegal for anyone to buy any vitamins or nutrients from health food stores. They had to go to a doctor, get a prescription, and pay a premium price for a synthetic vitamin from the pharmaceutical companies. And so they held these big worldwide conferences where they wanted to bring it up and they wanted to push it onto the European Union and America. And so he led big protests and brought people in from all over the world to show up when these conferences occurred to let be known to the press what was going on and to pressure the pharmaceuticals to back off. And he was very successful at it for a long time, of bringing thousands and thousands of people in at these conferences. And some of the big ones, if they were going to bring it up, they actually tabled it. They didn't even bring it up for discussion because there was this huge mob of several thousand people outside talking to the press and talking about what their intent was. And anyhow, he spearheaded a lot of these things. He did do a lot of work with Linus Pauling. And he still is all over the world. He's in the Netherlands, he's in the U.S., he's in Germany some, he's in Great Britain. And he's written a tremendous amount of material. He's written some books. But they don't like him because he is taking away, if people listen to him, a lot of money from the pharmaceutical interests. At any rate, he's talking about cellular medicine, meaning if you give the cells the right things that they need, they'll take care of their own problems. And so he's got this little course that you can get free if you go to his website, and it's called Cellular Medicine Foundation Course, What You Need to Know About the Importance of Micronutrients to Health and about the work of our Health Alliance, what their intent and purpose is. And so it's pretty good. It's actually very, very colorful and shows different details about disease and cell function and what nutrients are necessary to make the cells function properly. And so it's a good starting point to kind of give yourself some information. Then he has some more advanced. This is the very basic beginning, but it's free. You can download it, and you can study it, and you can even take an exam at the end of it to see how well you did. And so I printed it out and put it in this notebook, and it's almost like PowerPoint slides, but done up very well and very informative. Actually, if someone doesn't know a whole lot about biochemistry of cell function, it's a good basic introduction without getting too technical, and you would enjoy learning the information you can glean from this. Anyhow, if you go on the internet to Wikipedia, you are going to find that they are going to blast Dr. Roth, or Dr. Rath as we would say. They're going to blast him, and if you keep in mind what I said, you're going to see how they kind of infer, well, gee, he's made some money, and he's done this, and he's done that, and he's had clashes with the authorities, and the medical people don't believe that what he's saying is accurate, and they've tried to shut him up and put him out of operation, and so forth, and in essence trying to make him look like some terrible, awful guy. Now, when I contrast that with a pharmaceutical taking a virus that they had generated in kidney cells of green monkeys and finding out after they had created a vaccine that it was contaminated with another virus from the monkey family called SV40 that could create tumors in the human body, and making a decision to release it on the market and put out millions and millions of doses of it to people, knowing that they were receiving a toxin that could generate tumors, especially brain tumors. Now, did they do it free? No. Do they make any money with vaccinations? A fortune. Are they liable for any damage? No. They were very skillful in going to the U.S. government and getting a law passed that they don't have to be liable for damage due to these vaccines. So did they worry about putting it on the market because it might hurt someone? No. Did people die from it? Yes. I personally know of a person that had 2 brain surgeries for a tumor, and the doctors told him it was caused by the SV40 virus. Now, who's ethical? He makes a little money selling supplements and has helped a tremendous amount of people who would testify that what he did was beneficial, or the companies who put out millions of doses knowing they didn't have to be liable for any problems from it, and knowing that it was going to cause tremendous health problems and deaths to people. Now you tell me who is more disreputable. And I'm saying all this to say that you need to look yourself and weigh what the problem is. The problem is, here's a person who's come along and he's going to educate a lot of people to be healthy on their own. He's going to tell them, he offers supplements for sale, but he doesn't say you have to use his supplements. He's saying what it is that he's using and why he's using it, and you're free to go get it any place. But are you going to be able to go out on any place and buy your $20 a pill antibiotic prescription? No, you have to buy it through the medical establishment and pay the big bucks. In fact, in this country, of course, the premium bucks, because the drugs are more expensive in the U.S. than any other country in the world, and there's no control. So I'm only saying that to say you have to look at the motivations. And when they start saying, well, there's no evidence, and blah, 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 and therefore he's a bad guy because some doctor said, I don't believe what he said is true, you can find, and we've mentioned before about Dr. Wakefield out of England, how they tried to destroy his reputation because he only expressed an opinion. He didn't even say it as an absolute. He expressed it as an opinion. They lied about him. They brought up all kinds of garbage. They accused him of being a fraud. They accused him of being disreputable. They accused him of doing it to make money, and he didn't make a buck on it. But anyhow, this is the kind of stuff that goes on, and I hope people begin to wake up. Now, this is one source of some information you can get from yourself, for yourself. And another pioneer, now you remember I've gone back and said that in the early 1900s they already proved that bad soil producing bad food creates deficiencies in human beings that lead to illnesses. These doctors who criticize, and one of the big ones you're going to find is a place called Quackwatch, who has been run by 3 renegades from regular medicine, and I say they're renegades, that's my opinion, because I think they're being financed by the pharmaceutical interests to go out and spread disinformation and to scare the public away from doing natural things. At any rate, they call it Quackwatch, and everything that comes up on the internet you're going to find in the middle of the subject, especially if it has to do with natural therapies or medicine or whatever, you're going to see their little blip come up about that this is all quackery, and go to their website and they'll point out how terrible and awful it is. And there's 3 doctors who are heavily involved with Quackwatch. One was Dr. Waxman out of New York. One was Dr. Barrett, who was a ex-psychiatrist. I never did find out why he was no longer a psychiatrist. And I know Waxman went into politics, if I recall, in New York, but maybe not. But anyhow, he's been a big problem. And the third one was a Dr. Renner out of Kansas City, Missouri, and a friend of mine knew him, how much of I think, a rat. That's what my friend said he was. Anyhow, I was looking for pulsed electromagnetic therapy on the internet, and I came up with several thousand citations of studies, either being done by universities or research groups, and I found that there was a piece of pulsed electromagnetic therapy equipment that was approved by the FDA to treat major depression and so forth. Okay, so studies being done by all universities. Right in the middle of this group of citations is this Quackwatch pops up, and this Dr. Renner comes on and says, there is no scientific studies that have ever indicated that magnetic fields and electromagnetic fields have any value whatsoever in treating humans. And here it appears in hundreds of studies that are either ongoing or have been completed, and here's equipment on the market, pulsed electromagnetic field, that shows that it does have value, and yet he continues to put out this garbage about it, that it's no good. So anyhow, Dr. Royal Lee, and I'm saying this because if you go on to Wikipedia, and remember Wikipedia is not absolute fact. Wikipedia is a lot of information posted by a lot of people, and if nobody counters it, it stands until somebody does. So you have to keep tongue-in-cheek when you read Wikipedia, because it may or may not be accurate depending on the subject, and especially when it comes to medical subjects, and especially natural medicine, there's going to be a strong bias on there, and you have to know that when you read that. And so Dr. Royal Lee was another gentleman who came years before. He's now dead. I think he died in the 60s. And so he set up a foundation called the Lee Foundation for Nutritional Research. And they're out of Milwaukee, Wisconsin. I'm giving you this reference because if you go to the Lee Foundation, they have a lot of good information on there. They did a lot of research and they published a lot of material, and a lot of it's free, and you can print out material. And I had printed out one. It's pretty thick, probably 30 pages or so, called The Battlefront for Better Nutrition. Nutrition has been one of those areas, of course, that the drug cartel has for years battered as being useless and a waste of your money, creating nothing but expensive urine. Don't buy the supplements, take the drugs. Okay, but you know what happened? Enough people realized that the drugs weren't getting them well, that they were constantly going back for more drugs because they were sick, and they started buying supplements. No matter what the drug companies said, the pharmaceutical interests, they continued to buy supplements. And I watched this transition occur, but I'm saying that because in this article, or this Battlefront for Better Nutrition, the comment is made that back in the time that this was written, which was 1950, that the head of the FDA at that point had testified in a constitutional court in Washington, it is wholly unscientific to state that a well-fed body is more able to resist disease than a less well-fed body. My overall opinion is that there hasn't been enough experimentation to prove dietary deficiencies make one susceptible to disease. Now, this was published in 1949. And so that even before that, they did the same thing. They made these comments, wow, there's no information that it should make any difference. He said, actually 10 years before the last comment, they testified in a summer court that degenerative disease, infectious disease, nor functional disease could result from any nutritional deficiency. Now that's garbage, because remember how vitamins came into play in the first place, because it was discovered that certain vitamin deficiencies led to some pretty bad illnesses, some even death. And yet here these people are standing before the U.S. court and testifying as an expert from the FDA that they have no benefit whatsoever. There is nothing to show that it's true. Now, once the public started buying the vitamins anyhow, and the sales went beyond a few $1 million to into the billions, guess what? The billions were coming out of their pocket. So I remember several years ago when all of a sudden there appeared on television, national television, a multiple vitamin put out by a pharmaceutical. And did they say, well, we've changed our mind, maybe these vitamins could be helpful? No, they saw the market was spending money on them, big money, and they wanted their share of the pot. And so without any change in position, they inferred, well, of course, everyone knows you should take vitamins. And buy ours, because we have put out a good vitamin. Well, the fact is, I personally think that they are synthetic and very poorly usable by the body, and it takes a lot for the body to get anything out of them. But if you go a step further, even in spite of all that, and in spite of what Dr. Nelson from the FDA testified in federal court, they put out the big PDR, same company that puts out the PDR for drugs, the PDR for nutritional supplements. Oh, why did they do that? Well, everybody knows you should take supplements. Talk about two-faced. And I just happened to open it up here, and it says under 5-hydroxytryptophan, which is the pre-form for serotonin in the human brain. 5-HTP has shown some usefulness in some conditions characterized in part by serotonin deficits, principally depression. It has also been shown to be useful in some with obesity, insomnia, fibromyalgia, and chronic tension headache. Research summary, blah, 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 blah. Oh, I thought nutrients and nutrition had nothing to do with any kind of body functions. Now, you remember what Dr. Nelson said. Dr. Nelson said that neither degenerative disease, infectious disease, nor functional disease could result from any nutritional deficiency. How interesting. To me, the bottom line is it's a huge industry and they want to make huge amounts of money. But this is a big laugh. Now, I can just throw in real fast that they also, after years of saying herbs have never been researched to show any efficacy or safety, therefore you should never take herbs. But guess what? People were buying herbs anyhow. So guess what? I don't have it handy here, but they have a PDR for herbal medicine for doctors to look at so that they won't be so totally ill-informed. And in that PDR, guess what? They have all these monographs of the efficacy and safety of all these herbs. And they call it herbal medicine. It's not just a nutrient as they've been made it required in this country. You can't say it's an herbal medicine. You can only say it's an herbal nutrient or supplement. But anyhow, they put out the book that says herbal medicine. And guess what? They got all these monographs which show the efficacy and safety of these herbs. And guess what? It came out of the German commission that has been in existence for years and years and years, and they knew about it all along, but they lied and said there was no studies. But now all of a sudden they want to sell you some herbs, so now they put out a PDR that says, oh look, we have all these monographs that show that it really can be helpful. It really can be a medicine. I'm saying all this to say, wake up, America. If you want to get rid of this outlandish, stupid, ridiculously high sick bill, and you want to regain some health, get back to the basics. Get on to the companies who put out junk food and get some real food. But to do that, you're going to have to get some real soil. And when you start doing that, you're going to find that there's fewer and fewer things that need to be treated. It was already established in the early 1900s. But the pharmaceutical interests, the people who make a fortune off selling the drugs, and that's going to be the stockholders, they make the money, and they're willing to make a lot of profit on misery by selling all of this stuff to people, and we never tie it together. Oh, the reason they don't want people using nutrients is because it's competition. It takes money away from the stockholders. I had an acquaintance who left one of the major pharmaceuticals because he was the supervisor in sales and marketing, and they told him every month, you have to show an increase in sales because our stockholders demand it. And if you can't do that, we're going to replace you with somebody who can. And so it's profit-driven, money-driven, and everybody likes to think, oh, well, the pharmaceutical interests are in business to help people. I guess that's enough for today of my tirade, but it bothers me because I hear the same stories over and over, and I hear everyone who comes along and brings something to the foreground that can be beneficial to people without poisoning their body and without destroying them in the process, being criticized and being pointed out, well, they're unscrupulous because they make a profit. Well, no supplement comes close to making the profit that pharmaceuticals do. Not even close. Anyhow, that's something for you to think about. And so what do you want to believe? Well, you want to investigate thoroughly, and you want to guess what the motivations are of the person who's making the wild critique about somebody. What are their motivations? What is it that they have to gain? Anyhow, this doctor I mentioned out of Kansas City, A friend of mine knows who he is and knows him, and he has a 2-story brick office building. He doesn't work, has no source of income, but yet he seems to have plenty of money to put all this stuff on the internet. And incidentally, they tell lies because they were sued by some people that they lied about, and the people who sued them won, got a judgment against them for several $1,000,000 because of their false information. So I'm only saying that to say, you better look at all sides and reach your own conclusions. Don't let some critic come along who has ulterior interests and try to discourage you from thinking for yourself. Until the next broadcast, go to our website, mindyourhealthcast.com. It was nice being with you again, and we look forward to talking with you this next week.